H. pylori. Did you know nearly half of the world's population is infected with Helicobacter pylori, H. pylori? It is the primary cause of stomach ulcers and gastritis. Where does this bacteria come from? Can we get rid of it? Everything you need to know. Medium light skin tone, hand pointing down. White heavy checkmark. What is H. pylori? Helicobacter pylori is a spiral-shaped bacteria that has adapted to survive in the acidic environment of the stomach. It does this by making an enzyme called urease that helps neutralize stomach acid and allow the bacteria penetrate the mucus lining. Over time, it can cause problems like gastritis and peptic ulcer. White heavy checkmark. How does it spread? Person-to-person contact. You can get it by sharing utensils, kissing, or using same glass with an infected person. Contaminated food and water. You can get it by eating or drinking anything with the bacteria in it. Poor hygiene. Not washing your hands after using the loo or before eating increases the risk of infection. White heavy checkmark. What are the symptoms? Most people don't show signs of infection. However, if the bacteria damages your stomach, you feel burning or aching pain, especially if your stomach is empty, bloating or feeling full quickly, nausea or vomiting, loss of appetite, dark or blood stools. If left untreated, H. pylori can cause serious complications. White heavy checkmark. Complications of the bacteria. Peptic ulcers. About 70 to 90% of ulcers are caused by H. pylori. Gastric cancer. Over time, chronic inflammation increases the risk of stomach cancer. Gastritis. This is the inflammation of the stomach lining leading to digestive issues. White heavy checkmark. How is it diagnosed? H. pylori can be diagnosed using a breath test, stool test, blood test. Treatment is done using a mix of antibiotics and proton pump inhibitors to heal the stomach lining. It's important you adhere to your medications. White heavy checkmark. How to prevent
Best way to avoid
H. pylori is by practicing good hygiene. Wash your hands thoroughly with soap and water after using the bathroom. Avoid sharing utensils with people. Avoid contaminated food and water. Keep your environment clean. White heavy checkmark. Bottom line. Most people don't know H. pylori is the primary cause of ulcer. Although asymptomatic in most people, it can lead to complications if not treated. You can prevent contracting this bacteria by practicing good hygiene and minding who you kiss. Winking face. Pushpin. Suffering with ulcer for so long? And now drugs seems not to work? I'm having a 1 week's healing process for people with ulcer. The group is just open for 20 people only. If you're ready to take charge of your health and heal yourself from ulcer, then you need to join this. Send a DM now if you're interested. Only limited slots. Remember, it's not free. Only for serious people, please.